Welcome back. It is 10 minutes before 10 on a beautiful Tuesday morning. So, there has been many media reports about the outbreak of the HMPV in China, which have gripped the attention of the entire world. Now, we're trying to decipher into these informations and the reports. And joining me on this will be Dr. Evie Rapiti, who's a family physician. Dr. Rapiti, thank you for your time and welcome to Salam Media.
Hi, good morning to you and to your listeners, and thank you for inviting me.
Thank you very much. Dr. Rabiti, to start with it, we need to understand what we are dealing with. So the first question, obviously, is understanding exactly what is HMPV and how does it spread?
Okay, first of all, the acronym HMPV stands for human, and that is because it affects human beings. Meta refers to a term where we talk of a number of things, and I'll explain in this instance why we talk a number of things. And the word pneumo means pneumonia and, of course, virus. Meta meaning that it's not a single virus. Like normally one would talk of, say, a flu virus or coronavirus. But what seems to be the situation from what we're getting from Chinese authorities, remember we're getting from Chinese authorities, nobody else, the WHO, nobody's telling us exactly what this pathogen is like. They say, first of all, it's an unknown type of a pneumonia, which I find a little bizarre. And secondly, it has symptoms similar to influenza. And so it looks very gobbledygook for me because the coronavirus has symptoms of a flu when I've been treating it for COVID in the last 3 years. And also it had, and the difference from influenza was that this had presented or ended up with a pneumonia, and I can explain that to you later. So they use the word meta to show that it's a number of different types of viruses or strains, which it isn't. It is one virus which has symptoms similar to a flu, as well as those of the COVID virus. And in the COVID sector, it would be the pneumonia complication in which it presents. So the way it spreads is it spreads through droplets. It's a respiratory virus, upper and lower. So people with coughing and things like that could spread the virus. But having said that, most flus are that way down, they respiratory viruses. So I, for one, don't see the need for us to go into the old methods of masking, safe distancing, and sanitizing. Because generally people, when they cough, they don't cough excessively to spread enough droplets. And secondly, there have been no studies to show that using masking stops the spread or prevents you or protects it. Because I think what we need to understand and need to emphasize this point very clearly, that the size of a virus in this instance is 5 microns. The pore in your mask is about 300 microns, which is about 30 times or 60 times bigger than the virus. So I can't see how the mask is going to stop the spread. So from that point of view, it was a waste of time. And in this country, they were even allowing you to use a cloth mask, which is about, the pore would be about 1,000 times bigger than the virus. So it's just theater. We'd call that theater to say you're being protected. And there's no need for worrying about being protected. Now, the next issue that might be of concern to your viewers and your listeners is that it's coming from China, and we're looking at these footages that makes the thing look very scary. I'm a little reticent in accepting everything that comes from China, because remember, they were very reluctant and not very open in giving us information. And I get the feeling that the Chinese government is very hyperbolic when it comes to treating minor infections. The minute somebody sneezes, the entire community is locked up into terrible prison-like conditions, which is not the way it should have been done. If anything, we saw with the Omicron virus, if people were let to spread about, walk about, they get infected. Because this, by and large, the Indian authorities who have studied this, and they're the closest to it, have come out clearly saying that this is not a serious virus, it is containable. And I don't buy this for 1 second. They said they don't know what they're treating, they don't know what it is. For your listeners, I want to explain that there are treatments that one can use to treat flu virus and COVID virus. Using supplemental things like zinc, high-dose vitamin C, and zinc and vitamin D. When I say high doses, it's 5,000 units a day, not piddly doses that's recommended by your doctor of 400 units. I would say and then also the other point, and then there are things like hydroxychloroquine, doxycycline. These are antiviral. They would work. And simple measures like gargling your mouth, salt water, because remember it's an upper respiratory tract infection. So the minute you get a little scratch or a sign of a flu, gargle your mouth, and 90% of your viruses reside in your upper uh, throat, in your nasal passages. So wash the nose with saline water, warm saline water. You don't need to buy fancy stuff from the chemist. You'd make it yourself. You don't have to be accurate in your dosage. You're not putting salt. Just squirt a bit of salt into the half a cup of water and use the cup of your hand and throw the water into your nose and throat and just clean it out, and that will kill the virus. So these measures, by and large, 90% of your virus resides there. If you kill it, you minimize the possibility of it multiplying and descending into the lungs. But if
Mm.
it's to a situation where we have a pneumonia, I don't know why the Chinese are calling it an unknown pneumonia. We know what happens with the COVID when it lands into the lung. What actually happens is that it evokes what's called an anti-autobody autoimmune response. Now, for your listeners, what an autoimmune response is that when you get a foreign body in any part of your body, what your body does, it produces antibodies that attack this foreign body, but in the process, it attacks the cell, in this case, the lungs, and causes a pneumonia. So it's called an organizational pneumonia. You don't use an antibiotic really for that. The only reason you use it is for what we call secondary bacterial infections. The treatment there was prednisone, and I speak with some qualification on this because I've treated people with oxygen levels as low as 35%, and I've gotten them better using high dose prednisone and low flow oxygen. The other big load of rubbish that they're talking about, these media journalists should start doing their work before they scare the public. You don't need ventilators because the story of using ventilators in ICU was the biggest cause of death because 99% of people who went to our big ICU units and were pumped in with ventilators did a very stupid thing, and 99% of them died because when your lung tissue is damaged, it cannot take high flow oxygen. It stands to reason. You don't need to be a doctor to know this. When you
Mm.
use high flow oxygen, high pressure oxygen into damaged lungs, you will cause what's called a pneumothorax. That is, the air goes into the wrong place and that collapses your lungs, and the result is certain death.
Mm.
So I don't want to say too much that's going to make me into trouble about pulmonologists who go gungo and start pushing tubes into people. I just felt that if you treat the lung tissue, the damaged lung tissue, and use low flow oxygen and do it on a prolonged basis, and use supplemental oxygen, things like sitting in the sun, those red rays, of the sun seem to have some therapeutic benefit, contrary to what people think. The sun is bad for you, the sun is good for you. So yeah, I wouldn't worry about it in terms of what is the story in Africa. We've got enough antibodies from our natural immunity from the previous infections. I'd like to let your listeners know in the COVID-1 infection back in 2001, they found that there were antibodies in those people that still existed right up in 20 years later, and they were pretty effective against COVID-2. And so I don't think we should worry because Africa only had about 8% vaccination throughout the countries. And we had the lowest death rate, we had the lowest infection rate, and that was primarily because we had previous infection. And secondly, Africa was using ivermectin to a large extent for tropical infections like filariasis and onchocerciasis, which is river blindness. So ivermectin was found to be very effective against this virus. It's got the property even of being antiviral. Even though the WHO and all the wannabe medical associations don't want to accept it, but there are numerous studies showing that it was highly effective. So I don't think we should worry. And if anything, if this virus was so pathogenic, so dangerous, in terms of the way it was spreading, it's almost 2 weeks by now. That virus wouldn't have been restricted to China. It would have gone like the Delta strain throughout the world. It wouldn't have worried about barriers. So I think what we're seeing in the media seems to be very fixed. It seems to be planned. It seems to be a creation. I don't sound like a conspiracy theorist, but I'm a logical thinker. Where is the evidence? Is it coming from China? How do we know this is really coming from China? Because I know what the story was at that time. At that time, it was said it was rumored, but what they were doing at that time when the COVID came out, they were embellishing it, making it very big to scare people into thinking, well, if it's so bad, then COVID is a dangerous disease. People are going to die. We're going to force you to stay indoors, locked. That's all rubbish. Locking the economy, safe distancing and sanitation. There's been no studies. I would like one of our famous virologists who've been advisors. And they're not even virologists. Some of them are just epidemiologists who consider themselves experts. They're not experts on COVID, certainly not in the clinical sphere. I think frontline GPs like myself, Dr. Jackie Stone, the late Jackie Stone, Dr. Shankara Chetty, we're the experts in the clinical management of COVID because we have the successes to back us about what we're saying. To your listeners, what I want to say, do not be afraid. This to me sounds like an ordinary flu. It only affects you during the winter and autumn months. We're far away from it. Yes, I have seen 1 or 2 COVID pneumonias. It was so rare for me, I almost forgot how to treat it, but I treated it. Patient had a pneumonia, she had an oxygen level drop. She was fine, didn't need to go to hospital. And the PCR test, it's a load of rubbish. I don't think it's not really proved. It's not accurate. It costs money. You don't need to do it, and you do not need to panic. And about the thing being affecting children and elderly, of course it would affect children, but it doesn't mean to say children are going to die. In my experience, children did not die from this disease. I had some pretty severe pneumonias, 1 or 2, but the rest of them all survived. Children have good immune responses. We must guard that. And it's good when they get infected. I would rather get an infection that has mild symptoms and get natural, good, lasting, lifelong immunity than to take some poisonous, untested vaccine. Where the elderly are concerned, what do you expect? Their immunity is low. They've got chronic illnesses. They're going to get affected. They're going to get ill. That doesn't mean to say elderly people must be afraid. There is treatment for them. I've treated people up to the age of 80, 90. They are surviving. Yes, sir. They had oxygen levels of 70. They're 3 years on, no complications, and they're doing well. Sorry, I'm probably over time. You have any questions? I thought I'll just run through it because you have loads of time.
Yeah, no, most definitely, Dr. Rapita. I think you covered everything that we need to know and learn about the HMPV. And obviously, the main concern was that should we be worried, and also if there's any chance that if it does come on the shores of South Africa, are we looking at a global lockdown again? But you did answer that for us. And thank you very much for your time, Dr. Rapiti. And we really hope that things get better for us in the medical field as well.
We'll deal with it when it comes, sir. I'm not afraid of it. I'm 76. Still, I survived. I exposed myself to 3,000 people, minimal protection. Because once you've got natural immunity, this is the rubbish people need to know. I'm addressing this to our immunology experts who advise our government. If you've got natural immunity, you can't get reinfected with the same virus. What rubbish is this? I mean, you're an intelligent man. When you got the flu, did you get it again in the same state? You didn't, because you had natural immunity. So I think what I want to say to you is that do not be afraid. Enjoy 2025.
Right. Thank you very much. And have a good day, Dr. Rapiti, and also a wonderful 2025 to you also. And we hope that when it does come to us, so we will know exactly what to do by following your steps that you just guided us through. And please do have a good time. Thank you.
You too. God bless. Cheers. Bye-bye.
Cheers. That's Dr. Rapiti, a family physician, taking us through the news of the outbreak of the HMPV in China and if we should be worried or not. And he says, don't be worried, and we'll tackle it when it comes. So let's take a quick break. After this, we'll be speaking to the AMA team, which are currently in Malawi as we speak. They're going to different remote areas. And on that, I'll be joined by Mohammed Tahir, inshallah. Let's take a break.